we have received actually 3.2 million doses of polio, and then we are expecting another 3 million doses of BCG vaccine. And so really there is no cause for alarm. We will do the catch-up campaign. We will get all the children that have missed their doses. We are asking all the mothers to bear with us, but we are also assuring you that there is no cause for alarm, absolutely. All children will get vaccinated. Gladly, the vaccines that we are receiving, we are going to have around 5 months of stock, and we have already made an order for the second batch of the vaccines. These vaccines that have arrived, we made the order on my first day of office on the 17th of April when we assumed here, and with the leadership of the Cabinet Secretary, we ensured that we are engaging the necessary stakeholders, particularly the National Treasury. We want to really thank them, and the UNICEF, so that then we could get these vaccines coming. And now we are also engaged to make sure that we are getting some more supplies in another 8 to 12 weeks, so that we could extend the vaccines stock that we have in the country. Currently, as we speak, we are running low of the vaccine for BCG vaccine, which is the vaccine for TB, and also we are running low on the polio vaccine. And those are the only two vaccines that we are running low on. We have 2 weeks of stock. As we speak, there are 35 counties that still have the vaccine, and around 12 counties that have run out of the vaccine. And what we are doing is to redistribute. For example, we have taken some vaccines from Garissa back to Nairobi, from Meru and Embu, back to other counties in Western, such as Trans Nzoia, and we are trying to make sure that we share what we have in the next few weeks. But we also have good news, and today I want to announce to the country that we have today received at the port polio vaccines that is undergoing clearance, and in the next 8 days, those vaccines shall have been distributed countrywide. And that means that as we redistribute the 2 weeks of stock that we have across the country for the hospitals that have run out, we are trying to get the hospitals that still have a stock, and we are very grateful for the facilities that are sharing out. Initially, there has been a bit of concern, and so some people are hoarding vaccines. You find a facility has some stock of vaccines, but they are not willing to release. But now, with the assurances that we have received vaccines at the port, we are sharing out as we clear the vaccines that have arrived, and as also we work on the distribution. For the last 1 year, there has never been any procurement of vaccines, and because of a number of challenges, some that are global and some that are local. As we know, Kenya is among many countries that have aggregated the procurement of vaccines through UNICEF, and there have been a number of challenges in the global supply chain for specific vaccines. And this is something that is not just being experienced by Kenya, but is also being experienced by a number of countries. We, however, also, as I've noted, there is still some global supply chain challenges, particularly with also rotavirus, and several countries have already sounded a concern. Gavi itself has already written to the beneficiary countries on the concerns that we are having. Luckily for Kenya, we still have 1 month stock of rotavirus, and we will be monitoring the situation as the time goes. And we want to assure Kenyans that we will do everything possible to make sure that we are protecting ourselves against vaccine preventable diseases. We know how valuable vaccination is as far as protecting the health of the country is. And this is what we are working on day and night to make sure that we do not have any child or anybody that is going to miss vaccines. We have adequate stocks adequate stocks for all the other vaccines. We have adequate stocks for DPT, that is the diphtheria vaccines, the pentavalent vaccines. We have adequate stocks for measles vaccines, for rubella. We have adequate stocks for HPV vaccine, and we are urging all our people to go to the facilities and receive vaccination. We are urging facilities to support us, and we are very grateful for the many facilities that have now opened up and that have allowed us to redistribute some of the stocks that they have. And we want to assure the country that this problem will be amicably sorted out.